Good evening, everyone. I am Dr. Sravan Kumar, working as a consultant nephrologist at Verma Hospitals, Bhimavaram. So, we'll be discussing about pedal edema in CKD. Its etiology of pedal edema in CKD as well as treatment. So, in today's session, we will discuss chronic kidney disease and its association to pedal edema along with its causes, symptoms, and treatment. First, let's see what chronic kidney disease is. So it is nothing but continuing and permanent degeneration of the kidneys. So the kidneys are vital organs in the human body. They serve a variety of purposes, including maintaining the body's mineral and electrolyte balance, assisting in the production of red blood cells, and maintaining acid-base balance of the blood, and excreting water-soluble waste. Kidneys that have been damaged lose their capacity to execute the above said functions. So there are 5 stages of chronic kidney disease. In CKD stage 1, kidney is normal with more than 90% of the kidney functioning. And in stage 2, the kidney function mildly decreases to 60 to 89%. And in stage 3, kidney function decreases mild to moderately to about 30 to 59%. In stage 4, the kidney function severely decreases to 15 to 29%. While in stage 5, CKD, there is kidney failure and the percentage of kidney function is less than 15% and the patient requires renal replacement therapy. So since the kidneys can compensate for lost functions, signs and symptoms may not appear until permanent damage has occurred. Some of the commonly observed CKD symptoms, depending on the severity, are pedal edema, that is nothing but swelling of feet and ankles, and loss of appetite, nausea and vomitings, sleep problems, urinating more or less, diminished mental sharpness, muscle cramps, high blood pressure, and shortness of breath. As we looked at the signs and symptoms of CKD, one of the major symptoms is pedal edema or swollen feet and ankles. So what is pedal edema? So pedal edema is a swelling of the feet and ankles caused by the abnormal buildup of fluid in the ankles, feet, and lower legs. The edema of the foot can be caused by 2 different mechanisms and can happen in unison or separately. So let's see how pedal edema is linked to chronic kidney disease. Edema forms in patients with CKD are for 2 reasons, either due to heavy loss of protein in urine or impaired kidney function. So heavy loss of protein in urine is called Nephrotic Syndrome. So Nephrotic Syndrome is defined as a significant loss of protein in the urine along with edema. So a decrease in protein called albumin in the blood because of loss of albumin in urine results in reduction in fluid in the blood vessels. So protein maintains osmotic pressure in the blood. So once osmotic pressure in the blood is lost, so there is seepage of blood from blood compartment to the extra blood compartment, that is vascular compartment to the extravascular compartment. So there is decrease of fluid in the blood vessels. So because of decrease in fluids, the kidneys will then detect a decrease in blood volume and attempt to retain salt. As a result, fluid collects in the tissue, resulting in edema. So pedal edema can also occur when someone stands or sits in the same posture for an extended period. The symptoms of pedal edema symptoms include swelling or puffiness of the tissue just beneath the skin, skin that is stretched or shiny, skin that retains a dimple or pits after being pressed for several seconds. Let's take a look at ways to reduce pedal edema caused due to chronic kidney disease. So treatment of pedal edema includes addressing the underlying cause, that is lowering salt intake and in many cases using a diuretic to eliminate excess fluid. It may also be beneficial to use compression stockings and elevate the legs. So first is reduce salt intake. So edema can be exacerbated by the sodium intake, so which is present in table salt and processed foods. So reduced salt consumption can help in minimizing edema, especially if you are in a diuretic. And next is use of diuretics. So diuretics like furosemide and torsemide and other diuretics like metolazone. These are the diuretics which we use commonly in kidney patients, chronic kidney disease. So these are the class of drugs that induce the kidneys to eliminate more water and salt, hence reducing edema. Because eliminating too much fluid too rapidly can drop in blood pressure. So it causes lightheadedness and fainting. And further damage because of decreased blood, fluid in vascular compartment, it damages further of the kidneys. So thus diuretics must be administered judiciously. After using a diuretic, you may need to empty your bladder more regularly. However, when diuretics are used at the prescribed dose, other adverse effects are infrequent. So third is compression stockings. They can be used to both prevent and treat leg edema. Although good measuring and fitting of the stockings can limit the risk of discomfort, certain stockings can cause skin irritation or pain. Effective compression stockings exert the most pressure at the ankles and progressively decrease pressure upon the leg. And body positioning. Elevate the leg above heart level for 30 minutes, 3 to 4 times a day. Can help with leg, ankle, and foot edema. Additionally, elevating one's legs multiple times a day may not be feasible for individuals who are working. Lastly, it is not always possible to prevent CKD. So CKD is a progressive disease. So controlling diseases like high blood pressure and diabetes, on the other hand, can benefit. If you are at high risk for CKD, you should get regular testing. Early detection of CKD can aid to slow its progression. Limiting salt intake, choosing foods with low sodium, low potassium, and having physical activity can help with reducing edema caused by chronic kidney disease. Thank you, everyone.